is Joyce Gibb. Thanks for being here with me today. The conventional medicine typically uses, it's called thyroid suppression therapy, after somebody has partial removal or removal of their lobe of their thyroid due to some types of thyroid cancer. And so they use thyroid suppression therapy, which means they lower the TSH to an extent that is supposedly to be beneficial to help so that there isn't recurrence of the cancer. But there are some recent articles out I wanted to go over today, and just to update you on that. The first one is in the Journal of Clinical Medicine, August of 2019. So that was just really recently. And it is from Dr. Lee and Dr. Jian are the two top authors in this study from Seoul, Korea. So the title of the article is Optimal Thyrotropin Suppression Therapy in Low-Risk Thyroid Cancer Patients After a Lobectomy or partially removal of their thyroid. This study was aimed to identify the clinical results after TST suppression or cessation when they stopped the therapy, and evaluate clinical factors associated with successful TST suppression or cessation. So there were patients who underwent a lobectomy due to low-risk papillary thyroid cancer, and they compared the characteristics and the outcomes between the patients who succeeded to stop the thyroid suppression treatment and those who failed to stop it. There were a total of 363 patients and who underwent lobectomy due to low-risk papillary thyroid cancer. They compared the clinical characteristics and outcomes between those patients. There were, of the 363 patients, 53.2% succeeded to stop the thyroid suppression therapy, and I assume the rest didn't. The risk factors were of successful cessation were the preoperative thyroid stimulating hormone, the TSH level, and maintenance period of TST or thyroid suppression therapy. Patients with a low TSH had a higher success rate for stopping the levothyroxine therapy than patients with a higher TSH level, and that level is 1.79 or under, or the higher level was 2.76, plus or minus about 1.82 and 1.08. Patients who failed to discontinue the treatment showed a longer maintenance period. So what the conclusions of the study, the conclusions were the preoperative TSH level and the maintenance period of this suppression therapy are important factors for being able to stop the TST. And so what they found was that a lower TSH helped stop the suppression therapy sooner. So that was in August of this year in Journal of Clinical Medicine. The next study was done in the molecular imaging radionuclear therapy in June of 2019, and this is from Ankara, Turkey. Dr. Soydal is the author. Risk factors for predicting osteoporosis in patients who received this thyrotropin suppressive therapy for differentiated thyroid carcinoma. Now, it's a bunch of big words, but basically they use the TSH as the guide to how low they want to get the suppression therapy down. So here's the objective. Endogenous means within. Hyperthyroid, which is suppressing the TSH, accelerates bone turnover and shortens the normal bone remodeling cycle, which reduces bone density. So what happens? Your body breaks down bone, builds back up, breaks down, build up, breaks down, build up. So it's estimated that suppressive levothyroxine therapy, lowering the TSH, also decreases the bone density. So that was the suggestion. But the aim of the study was to define the risk factors for osteoporosis development in patients undergoing this suppression therapy after thyroid cancer. So the methods, they use the guidelines in the American Thyroid Association 2015 guidelines, and they looked at people that were fit to undergo a femur and lumbar vertebrae bone density studies. The risk factors they used: gender, age, menopausal status, smoking, family history of osteoporosis, preoperative thyroid hormone status, which is the TSH, post-operative parathyroid, hypoparathyroid history, mean TSH levels, duration of therapy, etc. So they did bone mineral densities of the femur and lumbar spine, checked a vitamin D level and a parathyroid hormone level. So during the suppression therapy, and this was an average, the mean of 7.2 plus 4.5 years, the range was 1 year to 26 years, osteoporosis was detected in 9.6% of the patients. And so what they found was patients with or without a family history of osteoporosis was significant. If you had osteoporosis, family history, it took 15.3 years till from the time to get osteoporosis after suppression therapy, and 20 years it took. It's 20 years without the suppression therapy. So the mean time to develop osteoporosis was also significant in a shorter period in postmenopausal women as compared to premenopausal women. So what the study basically ended up showing was that postmenopausal women, men, and patients with a family history of osteoporosis who receive TSH suppression have a tendency to develop osteoporosis more. So you just have to, postmenopausal women are always prone to osteoporosis, along with having suppression therapy just compounds that. So the last study I wanted to talk about was by the Endocrinology Metabolism Journal in Seoul, Korea, and it's 2019, June 2019. Post-operative thyroid stimulating hormone levels did not affect recurrence after partial thyroid removal in patients with papillary thyroid cancer. And this was Dr. Lee was the first author on this study. So the background, TSH suppression is recommended for patients who undergo a thyroidectomy for differentiated thyroid cancer. So, however, the impact of TSH suppression on the outcome of low-risk thyroid cancer remains uncertain. So they investigated the effects of post-operative TSH levels on recurrence, like how if this thyroid cancer came back with low-risk DTC after thyroid lobectomy, and that is differentiated thyroid cancer. So they had the partial thyroid out. There were 1,528 people in this study, and this happened between 2000 and 2012. There were 4 groups. The TSH was divided into 4 groups: less than 0.5, 0.5 to 1.9, 2 to 4.4, and greater than 4.5. Now, the average normal levels of TSH are usually 0.45 to 4.5 now. So what they said was recurrence-free survival was compared among the groups. So people that didn't have their cancer come back. So what did this mean? During the 5.6 years of follow-up, 1.4% of patients experienced reoccurrence. But the thing about that is their levels were within the normal thyroid range of 0.5 to 1.9. So the whole conclusion of this study showed that, traditional medicine typically suppresses thyroid therapy. They don't know how long, what that length of time would be that's really ideal for that. But they found that serum TSH levels did not affect short-term reoccurrence in patients with low-risk DTC after a thyroid lobectomy. And then the other last sentence states, TSH suppression should be conducted more selectively. So, many people now still undergo thyroid suppression therapy and hoping that this suppression will, reduce the reoccurrence. And that stated that the levels of 0.5 to 1.9, the normal range, the lower normal range, really was not significant, in recurrence. So, all right, if you'd like to talk about your thyroid and any treatment for fatigue, hair loss, outer eyebrow loss, any kind of gut issues, constipation, dry skin, I really enjoy treating thyroid patients and to help you get into better health. So give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.